Hi, hello, and welcome again to another one of our webinars. Today, I've got the amazing colleague of mine, Dr. Susanna Park. And one of the things we're going to talk to you about today is almost step one of the process, the physical process on your side, which is the pre-cycle testing. Dr. Park, hello.
Good morning, or shall I say good afternoon?
Or good evening, depending on where everyone is. I'm in the afternoon, you're in the morning. There we go. Pre-cycle testing is one of the things that a lot of people, it's the first thing that we speak about when we're talking about starting the journey. What is pre-cycle testing as a concept?
So prior to doing any treatment, it's really important that we understand the health of everybody involved. And in the United States, because a lot of this tissue is going into somebody other than yourself, the United States government agencies also regulate the certain types and the timing of these tests just to ensure that all involved parties are kept safe.
Okay, perfect. So let's today talk about male pre-cycle testing because I'm a man and that part I kind of get. So I assume I'm a client, I've come to you and I'm like, okay, brilliant. Step one, let's move forward. What would you recommend that I do?
So there are two things that we need you to do at first. Number one is just a basic sperm test, and this can be done at any country that you're living in, just to be sure that you have sperm. Now, one of the things I often get from men is, oh my gosh, what if my sperm's not normal? Is it still okay? And the answer is absolutely yes. I'm not looking for perfect sperm. I'm just looking for sperm. And it's okay that the concentration is not that great. And it's okay that maybe it's not the most motile sperm. And it's okay that maybe the shape is a little off. Because through in vitro fertilization, called IVF, we can actually overcome a lot of these issues through a process called ICSI, intracytoplasmic sperm injection, where we select manually one sperm that's moving and normally shaped, and we put it into the egg. Now, let's say you do a sperm test and surprisingly, there is no sperm. And you know what, Richard? Every once in a while, that happens. Okay, and it's just a surprise because even though you have no sperm, you still have ejaculate fluid coming out. And if that's the case, you still can do the process, but you may need something called testicular sperm extraction, where the sperm gets removed out of the testicles. So knowing all this before the treatment will help us better gauge the types of extra treatments, if any, that you would need in the process. So that's number one.
Okay, perfect. So let's focus a little bit on that. So one of the questions I'm asked over and over is, okay, so I'm going to go to my doctor. Do I just ask for a sperm test? Is there any specific kind? Do I need to do the sperm defragmentation testing? What do they ask for when they're going to their andrologist or doctor?
Great question. So some labs, when they do a sperm test, just do a count and a motility. But what we really want is a count, motility, and morphology. So we will give to you on a requisition exactly what kind of sperm test we need. The DNA fragmentation, that's a great question. So the acronym for that is DFI. And this is a test to get an idea of how damaged the DNA is in sperm. Because the more damaged the DNA is, the less likely that sperm is going to be successful in fertilizing and or creating a good quality embryo. And there are some places that routinely do a DFI. But in general, if your semen analysis is pretty good, you don't really need a DFI. But there's nothing wrong with getting a DFI. In the United States, it is a couple $100, so cost is always an issue in this process. But if you wanted to, that's fine, but we don't really warrant it unless the semen analysis comes back and is significantly abnormal.
Because I guess when you're looking at sperm under a microscope, you can't see in it, right? So if you're going to open it up to do the defrag, you're killing that sperm, so you can't use it anyway.
Correct.
Correct.
Correct. But
Okay.
now there's actually a relatively new technique that we're starting to implement called Zymote. And what Zymote is, it's this apparatus we have, and you put sperm into one end. And this mechanism helps us select the best quality sperm. And in theory, it also helps us to choose which sperm has least DNA fragmentation. So it's almost like a obstacle course for sperm. So you put sperm on one end, and then like the winners come out on the other end, and that's the sperm we use for the ICSI. So if a gentleman had a high DFI, we would certainly recommend Zymote. But now we're starting to implement it just routinely in all our IVF cycles, which kind of makes the testing for the DFI less of a controversy since we're still going to be performing Zymote.
And that, in theory, is increasing success rates of fertilization.
Right.
Okay, brilliant. And then something else that people talk to me or ask me about is the Erickson method. Can you maybe talk a little bit about that?
Yes. So the X chromosome and the Y chromosome. So many people don't realize this, but the sex of your child is determined by the sperm. So the X chromosome contains more DNA material than that of the Y chromosome. So in theory, if it contains more DNA material, it would swim slower than the Y chromosome. So the idea behind the Erickson method of sperm sorting is the faster moving sperm would be the girls and the slower moving sperm would be the boys. And it's just in theory, it's not an exact science. And the accuracy, so normally it's about 50-50, right? Girl, boy. But with the Erickson method, it's probably somewhere around 70%. So some people, when I tell them this, they say, oh, that's fantastic. Oh my gosh, I'm so happy. And other people, when I tell them this, they say, so why would we do this? Right? So what I tell my patients is, look, it's not an exact science, but it's the best we have in the year 2020. So if the sex of your child is so important to you, which I fully respect, then this is the best we can offer you. And if you do it and you don't get the sex you wanted, at least you know that you've done everything under the sky to maximize your chances of having the sex of the child you wanted. But keep in mind that this just helps us to select the sperm. You still have to do the pre-implantation genetic testing, PGT, to know with greater certainty, not 100% exact certainty, but certainly greater certainty that your embryo is indeed the sex that you wanted.
Okay, so it's almost like a pre-fertilization core, method to try and get a boy versus a girl or something like that.
Right.
But no exact science behind it. Okay. And then, so I've done my sperm test, I get the results back, and I think I remember, this is probably more information than the viewers or you need to know. But when we got ours, I nearly fell off my chair with the amount of abnormal sperm within my sperm deposit on that day. To your point, that didn't matter. Obviously, I've got two amazing children. My sperm is amazing, obviously. But what, if that comes back, what are things that people can do? Say, I got my results today and I have 99% abnormal sperm, but I'm not doing my procedure with you guys for another 6 months. What can I do in between now and then to maybe improve my chances of having better sperm?
Great question. So one of the things I do want to mention is a question I get all the time is people say to me, oh my gosh, does this mean my children will have birth defects? And it's a very logical question. And the answer is no. So abnormally shaped sperm does not translate to increased birth defects. Abnormally shaped sperm just translates into lower fertilization rates. But again, the IVF process with the ICSI will overcome that. So there's a lot about sperm we don't know. But we do know this, that sperm does not like high sugar, sperm does not like high fat, and sperm loves antioxidants. So all the yummy things in life, sperm does not like. Okay, so I tell my patients, I've been doing this 17 years, so I tell my patients, look, first of all, it takes 3 months to change your sperm because it takes about that long to synthesize new sperm. So I tell them, you really do need to make lifestyle changes. And so for many people, they can eat a bit healthier. So I tell them, scale back on the sweets, scale back on the meats, increase your fruits, vegetables, your antioxidants. And of course, increase your exercise and do your best to decrease your stress. But having said all of this, there's absolutely no guarantee that it's really going to change your sperm shape, but there's no downside to it, right? It's only going to make you healthier.
Yeah.
Now, sometimes if there are many parameters wrong in the semen analysis, it does warrant a trip to the urologist. A urologist is a doctor who specializes in male issues. And sometimes they may discover that you may have a medical reason for the sperm shape. For example, something called a varicocele. A varicocele is when the veins in your testicles, their job is to expand and contract to maintain body temperature in your testicles because your testicles are outside the body, right? So to keep it at body temperature, the veins have to expand and contract to control the heat. But if you have a varicocele, that means your veins are constantly expanded. So they can't contract. And therefore, the temperature in the testicle is affected, thereby affecting the quality of the sperm. So sometimes a urologist may diagnose something like that, which when fixed, may or may not improve the sperm morphology.
Okay. And then finally, sperm is obviously one of my favorite topics, but the things like smoking, drinking, drugs, recreational drugs, hard drugs.
Yeah, that's a good one. So smoking across the board is just not great. It's not great for your sperm. It's not great for your eggs. It really does affect your sperm. But the second thing that a lot of the patients I speak to don't realize is that there's something called SIDS, sudden infant death syndrome. And this is a condition where, and it's usually newborns, but it could be in a toddler, where your baby goes to sleep and the baby never wakes up. And nobody really knows why SIDS happens, but we do know that the risk of SIDS is higher if there was somebody who smokes in the house, even if you don't smoke in the house, but a smoker. So for those two reasons, I strongly, strongly, strongly encourage my patients, male and female, to not smoke. As for alcohol and drugs, that's a little bit tougher because it's very hard to quantify X amount of hard alcohol, X amount of beer translates into this percentage of damage to the sperm. And same with drugs. But a helpful advice is for alcohol is I tell people drink moderately, but don't get drunk. Okay. And as for drugs, like in California, marijuana is legal. And so there are people who do marijuana every day, sometimes for medicinal reasons, sometimes for insomnia, or just to release stress. And I tell them, again, we don't really know what daily marijuana does to sperm, but I encourage them to reduce it. That daily probably isn't great for the sperm, so maybe once a week, maybe twice a week. But again, this isn't based on great science. It's just scaling everything back to moderation.
Okay, brilliant. And I could talk sperm for days, but I think, so that's part one of pre-cycle testing. You said there was a part two.
Yes, so the blood tests. So in theory, you don't really have to do blood tests wherever you live. You can just come to our center and we will do all the mandatory blood tests. So these are mandatory by the FDA, the Food and Drug Administration of the United States, which is a government agency that regulates the testing that needs to be done when tissue goes into somebody else. However, if you come here to do your FDA testing and you also deposit sperm that day, should your blood work come back for a disease, an infectious disease that could have been treated, for example, let's say syphilis or chlamydia, then that sperm you gave me that day needs to be discarded. And if you live here, it's not a big deal, right? So you just make another trip to our center. But if you flew here from another city, whether it's domestic or international, imagine the waste of the money and your time that you came here, we're throwing everything out, and now you have to come again. So to minimize that frustration, we strongly encourage our patients to do a dry run wherever they live. And again, we will send you a list of all the tests, and you take it to your primary care doctor. And these are diseases that any primary care doctor can order because they're infectious diseases. And just sort of make sure that they are negative. And if they're positive, it's okay. We'll take care of it. We'll treat it so that by the time you come here, it will be negative.
Interesting. And on that list, there's one thing that I know here in Europe we don't test for, which is West Nile virus, because we just don't have it. So what do we do? Do we just ignore that and then hope for the best?
Correct. Because if there's, if there's a way you can get tested, no problem, and then we'll just test you here. Yeah.
Just if you've been to Egypt and you've been on the west side of the Nile, just be careful. Okay, brilliant. So you've got sperm, we've done the blood test, and obviously there'll be a urine test as well. What about saliva and genetic mutation testing?
So if you are the sperm source and you are then choosing the egg source, which is usually going to be an egg donor from, we have our own egg bank, eggdonors.com, but perhaps it's a family member. Well, while it's not mandatory, it is strongly recommended that DNA mutation testing be done. So what is DNA mutation? So we get our DNA from our egg source and our sperm source, and that's what determines your eye color, your hair color, how tall you are. And this does not change with time. This is the way you're born and it stays the same. And all of us have mistakes, mutations in our DNA, but you know what? We're so normal. But sometimes those mutations actually mean something. So for example, cystic fibrosis. Cystic fibrosis is a mutation on chromosome 7. And let's say you got the mutation from your sperm source, but not your egg source, then usually you're fine. But what happens if the sperm source has a mutation and so does the egg source, but you don't know because you're fine? Well, if both the egg source and the sperm source come together, there's a 25% chance that both of them will pass it on to the embryo. Now, if that embryo gets both copies, that embryo will then actually have the disease. And we call this inheritance pattern autosomal recessive. So to minimize the chance of this happening, these surprise diseases, which in many cases can result in a very sick child, we do strongly recommend that both the sperm source and the egg source get tested. Now, there are different DNA mutation companies, and we happen to use a company called Invitae, but it could be SEMA4, Council, and you can use your saliva or your blood. And many, especially now with COVID, it's just for many people, it's just easier if we send out a saliva kit. There's very specific instructions as to how to collect the saliva, and it's really important that you follow the instructions, because if not, the saliva kit will come back and you can't run a test on it, and then we'll then have to ship you another kit. So you put your saliva in it, and it will run for hundreds of different mutations. And right now it's about 287 mutations. And both the sperm and the egg source will run both of these tests. And again, don't be shocked if you're a carrier. We all carry mutations. You just want to make sure that you're not the carrier for the same mutations. And it takes about 4 weeks to get the results back. So again, this is one of those pre-cycle tests, right? Pre-cycle, where you really want to get it done early in the process, because you want those results back so that when you do select an egg donor, because on our website, eggdonors.com, for every donor, her DNA mutation results are already posted. So if you're looking through your egg donors, you just want to make sure that you choose an egg donor who does not have the same mutation as you have.
Okay, so in effect, you know, my genetics are not going to change. If I do that test today, it just goes in my folder for when I'm ready to move forward, correct? So there's no maximum time limit on that. what would be the time limits that you would like to see on the sperm test and the blood test?
You know, usually within a year is good. However, right, if you know that, wow, these infectious disease tests were done January of 2020, but, you know, I'm not really sure they're still going to be negative, and I'm about to go to the clinic in 2 months. My advice to you would be, ask us for another requisition, and let's just test you again before you come. So, but within the year is generally what we expect, but, you know, be wise about it.
If you've been out doing stuff, let us know and get it sorted, basically.
Right.
And does the intended parent need the requisition, or can they just go to their doctor and if we give them the list of things to be tested for?
Well, exactly. So the requisition is just so they know the names of the test. So they don't present to the doctor and say, hello, can you just test me, right? But at least their doctor knows the infectious diseases that specifically that we're going to be looking for.
Brilliant. Okay, so if you're listening to this and there's of interest, please email us. And what we can do is we can send you a list of all of the tests that you would need to be tested for. We can send you a list of all of the things that potentially could adversely or negatively affect your sperm. And we can also help you if you want to do the genetic testing. Dr. Park, as usual. Oh, yes.
I'm sorry, I just wanted to mention one other thing about DNA testing, which I run into a few times, which is many times I'll talk to patients and they'll say, oh, you know, I did it. I did that 23andMe. And while that is a test for your genetics, and they do run some DNA mutations, but their list of DNA mutations is very small compared to like a real DNA mutation test. I have patients who did it 5 years ago, when at that time the panel was 55 diseases, but now it's over 200. So it is strongly encouraged that you do thorough, comprehensive DNA testing of what is available in the year in which you're performing the treatment, which may warrant a repeat or an update of your DNA mutation testing. And also keep in mind that in 3 years, that panel is probably going to be over 500 diseases. So it's very possible that you were not tested for disease in 2020 because, you know, we didn't know about it. In the year 2025, now it's on our panel, and it just so happens your X source is now testing positive for that disease, but she didn't test positive in 2020 because we weren't testing for it because we didn't know about it. And so sometimes that happens, and then you will then get notified saying your egg donor is now tested positive for a new disease, but you weren't tested for it because it didn't exist in 2020, FYI. So sometimes that happens, but Richard, this is going to be the way of the future as DNA testing becomes more prevalent.
Yeah, that's a very, because I think we tested for 13 when we did ours. You know, not even 287, we did 13. And even then I came back with something, who knew? Anyway, Dr. Park, I think that's fantastic. Thank you. You know, a great set of information to be able to share with people. And if you've got any questions, please do not hesitate to reach out to us. As usual, we are here to help as and when you need. Thank you very much.
You're welcome. Ciao, ciao.